Hello, everybody with type 1 diabetes. My question for you today is, do you know that 80% of people with type 1 have A1Cs above 7%? That's not great, right? That means you're probably hitting 200 on a daily basis, or in millimole, that would be 11 or higher. But you know what? I've had type 1 since I was 7, so 40 years. I get it. It's hard. And I am very clear that the reason why people are not doing well is because most people have received about 25% of the training that we need and are missing the other 75. I have seen this in the hundreds of patients I've worked with privately for, I don't know how many years, 10 years. So if you feel like you are frustrated and your sugar levels are all over the place and you're scared of lows or frustrated with highs, first of all, I say have compassion for yourself because you are managing something that's very complex. And maybe you're trying to get an A when you only have received 25% of the textbook, which is kind of impossible. This is why so many type 1s are struggling and why so many type 1s don't have a good A1C. And I am on a mission to change that. So I'm glad you found today's video. I'm glad that you follow me. Today, in today's video, I just simply want to be a source of inspiration that there is more help out there, right? How I work with people is I do private calls or I have a membership program. And when I work with people, there are some very important steps that I want everybody with type 1 to know and to become masters of. I use the word navigate diabetes and not control, because control sounds like we got this. Like you just do your insulin to carb ratio and you got a perfect number before and after you eat and while you sleep because you're controlling it well. Well, good luck, right? Diabetes is a lot more complicated than that. So the word I like to use is navigate, right? And so imagine you are a captain of a ship, right? You're the captain of your diabetes ship. And you need to receive a lot of training before you take your boat out and sail across the ocean, right? And every time you take your boat out, you're going to have to do things differently. So that is the analogy. You are a captain of this diabetes ship, even though maybe you never wanted to be a sailor. You are now a sailor because that happens to all of us that get diagnosed. Okay, I'm going to learn how to sail the ship. And your life will be better when you learn how to navigate your ship, navigate your blood sugar levels in a more educated way, right? You'll understand how to avoid the highs and avoid the lows. And it's still going to have rough waters out there, right? The sail might rip, something like that. So I don't promise that diabetes is easy. I will never say diabetes is easy. If somebody says that, I'm very aware that they don't know what it's like to live with type 1 diabetes. It's not easy, but it will be easier when you get a full toolbox of tools, and that is what I offer. So to give you kind of an overview of the tools, is the first thing is you have to really be confident with setting your basal rate or your long acting. I personally am shots, so it would be long acting in my case, but basal rate on a pump or long acting, I'll use those words interchangeably. When you truly understand how to set those correctly, how to adjust them when needed, and to assure that they're set properly, that's step one. Everybody needs to know how to do that, and that's what I love to teach. Step two is we've got to dose beyond carb counting. If we're only dosing based on carbs, it's not really going to work because how would you dose for 30 grams of carb from pineapple versus 30 grams of carb from blank beans, right? Totally different approach. Timing, right? What's your timing of your dose? You've got to talk about that. And guess what? When you have a big omelet and a bunch of protein and fat, don't you go high? Yes, you probably do. So nobody talks about dosing for protein and fat. So we've got to talk about that. And that means that sometimes one shot per meal is not going to work, right? Because one shot works like this, it peaks and then it finishes. But guess what? Some digestions last beyond the peak. So that's the step, the second step that when people work with me privately or are in my membership program that we really dive deep into. And then of course, step three is how to be active and have a fun, healthy life and not worry about lows, right? I used to stuff my face all the time to not go low. when I was exercising, because that's what I was told to do, right? We're all told you got to eat more when you exercise. And no, when you know how to confidently dose your insulin properly and adjust it properly, you can avoid lows and you can avoid having to eat a whole bunch. Now, if you don't know how to do that and you go low when you exercise, then you still need to eat. So by no means am I saying you don't need to eat before you exercise. I'm saying that it's possible to not have to eat a ton or at all before you exercise when you know how to dose your insulin properly. So if you would like to learn more about what I am sharing, I certainly hope you do. Stay tuned for the next video. Spoiler alert, I have a membership program. It's called the Type 1 Diabetes Crew. You can read about it on the homepage of my website. Enrollment is open only until May 31st. I only open enrollment a few times a year, and right now we are in open enrollment. So it is a phenomenal program. You get the first week for free, and it's only $47 a month. And my promise is that you'll get some of the best education in how to be a better navigator of your blood sugars than perhaps you've ever received, no matter how many years or months or decades you've had type 1. It's called the Type 1 Diabetes Crew, and I am dedicated to reaching thousands of type 1s in that program. Right now, it's new, and I have 50 people in it, and I hope you're the 51st. So check out my website, Dr. Jody. You can just Google Dr. Jody Diabetes, and I come up. And click on, I have lots of buttons on my website that will take you to the crew. And so you can join for free only until May 31st. This is 2021 that I'm speaking to you. So I hope you see this video and I hope you join. But I have more of these inspiring videos coming out in the next few days. So stay tuned for more. Hope to see you in the crew. Bye for now.